Loud, emotional, and tired. Nurses in England, Wales, and Northern Ireland are putting it all out on the line.
In A&E where I work, we regularly have people queuing out the door from 9 a.m. and it doesn't stop until after midnight because there's so much need and demand out there and we don't have enough resource or service to provide care for them all.
Part of the issue, according to members of the Royal College of Nurses Union, is that people can't afford to be nurses. The job stress is immeasurable and wages haven't kept up with inflation.
We're here because this government has turned its back on nursing. And when they turn their back on nursing, they've turned their back on patients and they've turned their back on the NHS.
The union wants a 19% increase. The government offered 4.75. Inflation is more than double that, so nurses say they'll end up with nothing. Being out on the picket line is a bitter pill for nurses, especially these ones here at St. Thomas's Hospital. This is where former Prime Minister Boris Johnson was cared for after he contracted COVID-19. Back then, the government called nurses national heroes.
You had some family come visit you.
Rishi Sunak, the current Prime Minister, got an earful on the issue back in October.
It's a pity you don't pay them more.
Well, we are trying.
No, you're not trying. You need to try harder.
Right, I will take that away.
Asking for a 19% pay rise, way above what most viewers themselves are receiving, is not affordable given the many other economic pressures that we face.
Public support for nurses remains high, but the government hasn't budged. Workers everywhere, including Canada, are running out of steam. This demonstration linked to wages took place in Toronto on Monday. With COVID and other serious respiratory infections packing clinics and hospitals, many aren't sure they can keep going.
But I do see the struggles and it is real.
Another 12-hour walkout is planned for next week. Crystal Goomansingh, Global News, London.